got copies of I've got 1533. I mean, how long does it take healthcare workers, 5 or 6 healthcare workers, to sign their name?
They got to write their organization.
Okay, you know, I have become the mother of a 4-legged little corgi. I now understand about mothers when and the people that served in the legislature used to have to leave to make sure they could pick their child up out of daycare at 6 o'clock because Maggie's in daycare and they close at 6 o'clock. Oh, I will be. I didn't have that understanding of mothers. Right. Well, they'll all be quiet. Do you have to talk while you sign your names up? We're going to start with this. Everybody, if you just quietly sign your names. Okay, I'm calling this meeting of the Special Committee on Access to Quality Care together. And the first presentation will be from the chairman on the substitute to House Bill 1533, LC 339099S. Does everybody have a copy of the substitute? Coming up. She's coming with it. Now, does everybody have a copy? Okay, go ahead. You're on. Let's see. Okay. No, wait a minute. Table mic. That's
Me.
got it.
Thank you, Madam Chair, and thank you, members of the committee for bearing with us and getting some important legislation out. We've all seen over the past year some of the challenges with the healthcare workforce. We've actually seen a lot of the challenges with mental health across Georgia, and frankly, just passed a game-changing bill this past week on House Bill 1013 out of Chairman Cooper's HHS committee, and now from the House floor. One of the things, what we're attempting to do, a problem we're attempting to solve with House Bill 1533 is really more isolated directly to the healthcare providers themselves. Over this past year, we've seen those workforce challenges that we have commissions and all dedicated to trying to find solutions to. Part of what that's done is put incredible stress on nurses, physicians, and all the healthcare team. So a couple of options exist for those workers if they have a lot of stress. A lot of them have dealt with the family members being separated during COVID, and the nurses having to take on the role of both caregiver as well as advocate, as well as trying to hold the phone up to help a patient Zoom as they're dying with a family member. The stresses have been tremendous. There are options out there that exist outside of what we're trying to do in HB 1533. One of the problems, though, is that those are often run by the healthcare system itself, your employer, or it could be with your licensing board, which could be, say, the medical board, board of medical examiners. As you can imagine, providers are a little reluctant to necessarily go to their employer, even if they're assured a fairly confidential arrangement. There's always kind of a question in some people's mind on whether they can take some of the stresses, some of their thoughts, some of their maybe possibly depression, family problems, other things. They may not have a great place to go. They don't necessarily want to go to the nursing or board or the medical board. They may not rise to that level, and they may not be fully assured of the confidentiality of an employer-sponsored plan. So what House Bill 1533 attempts to do, if passed and signed into law, would create a professional program. If you look on line 22, basically career fatigue and wellness in healthcare professionals. And this one is particularly written to allow a trusted healthcare organization to do that. And we'll hear from them in just a minute. This would allow someone like MAG to perform a wellness and resilience program for nurses and other healthcare workers, physicians, nurses, and other healthcare workers. Part of the key part of it that we work closely with our friends at GTLA and judiciary members is to make sure that if I or any member of a healthcare team needed to go talk to someone, you could be assured that they are held to strict confidentiality standards. So it would prevent disclosure of information or reports that were created by that program that a caregiver might go to. It wouldn't, if there was a question of competence and safety to patients or risk or harm to themselves or others, that confidentiality would cease to exist. So this, just like always, if someone else is in danger, the confidentiality they'd owe to the participant in the program would change. I think this is important to make sure physicians and other healthcare workers are willing to utilize a program to help deal with some of the incredible stresses that we've seen, and frankly, with the workforce challenges we'll likely continue to see, and to help improve the resilience and the well-being of healthcare providers. And with that, Madam Chair, I know there's others that may want to speak more to the bill.
No.
I'm glad to answer any questions.
Okay, we have questions. Representative Perkle.
Just so I'm familiar, and I'm there again, I'm not a healthcare professional, and you can absolutely straighten me out on this. How closely does this resemble what we have for substance abuse or other type with healthcare professionals? Because I'm really unfamiliar with career fatigue and wellness. Is this somewhat analogous to what we have in?
There is a professional program within the medical board. There are times there are public orders that are written I know that's been enhanced in the past few years. I believe the other speaker will speak a little more to what the other options are out there for providers who, some of whom have to be encouraged or even that's the only way to hope to get their license back, for example. Those are, I won't say they're punitive. They're certainly rehabilitative, and they do a great job in a lot of ways. And we do want to keep those strong. This one doesn't affect those at all. It really just gives another option for something that doesn't rise to the level of needing the medical board involvement or the nursing board involvement or the pharmacy board.
Can I have a follow-up?
Yes.
Thank you for that answer. Just as a quick follow-up. So but because of what they've seen through the pandemic, we've seen a rise of the need for this. Not exactly like PTSD, but because they have seen things, they've worked long hours, there is some fatigue, and this encourages healthcare professionals to see a professional to get some help.
Exactly.
Okay.
It does that
Thank
by strongly assuring them, getting it away from their employer and away from their licensing board, and allows them to get help earlier before they get forced maybe to go to one of those others. So I think we'll hear more about the program from others.
Representative Prince.
Thank you, Chairman Newton. And you can sort of help me out here with you've been in prior military. So this is basically going outside the chain of command to an outside agency to seek help if needed. That way nothing goes bad.
Normally I would, outside the chain of command is not a comfortable term for me, but
that's
I know
what it
what you're
sounds
trying
like.
to say. You're absolutely right, though. It does give something to where you're not having to go to your employer and disclose things that you need to a counselor or counseling individual. You have another option. Those still exist, and almost every healthcare system has a program, and there is confidentiality, but we've found that providers, and particularly physicians and nurses, are a little bit reluctant when it's their employer. And frankly, a lot of physicians are employed by the healthcare system as well. So it just gives an option for the healthcare providers to seek help a little earlier, not be forced into it, not wait until something happens where they're forced into it, and not have to worry about the confidentiality of a program that's sponsored or paid for by their employer.
Can I follow up? And I so I understand that. However, at the end of the day, that employer, as we say, chain of command, is going to have to act or not act on whatever if they have a problem or something that they can't disclose. How does that employee, I mean, if this committee or program says, hey, yeah, you need to take 10 days off, but at the end of the day, we need you here at the hospital or whatever. Again, I'm just trying to figure out, where does that link come in?
I believe this is completely separate from whether you are self-employed or whether you're employed by anyone. It has nothing to do with your employer. It wouldn't change anything or be associated at all with that. I don't know, Madam Chair, if you don't mind, if a little more explanation and detail on the program as it's done in other states, it can be helped out by another presenter. I'm glad to answer again if there's still questions after that, if you don't mind.
I think that's a good idea. Okay. Recognition. Bethany Pura from Medical Association.
Hi, I'm Bethany Scher with Medical Association of Georgia. We have just over 8,000 physicians across specialties, across practice areas, across practice settings. They may be in hospitals, they may be in solo practice, they may be in large group practice, they may be independent contractors who work for hospitals. So not everybody has equal access to a program. And one of the things, before I kind of get into typical presentation, I'm going to explain in healthcare terms what this would be like. This is like primary care. This is before there's an emergency.
Right.
So this doesn't mean that I'm not competent to practice. This just means that I'm feeling fatigued, I'm feeling stressed, and I want to seek mental health care before I'm not competent to take care of my patients. So this is not intended to be something that the physician would wait until they needed to take 10 days off. This would just be, I need to see a mental health care professional, whether that be a psychiatrist, a licensed professional counselor, a therapist, whatever it is. I need to see them before I have hit the point that I may make a mistake. And so this is not intended to shield anybody from their employer in any way. And like Dr. Newton said, there are a number of programs under hospitals and employers across the state. Not every hospital can afford to construct a program like this, especially if it's a rural hospital. They may not have the capacity to have a program like this. But if this allows a physician to access it, I'm an attorney under the State Bar of Georgia. I have access to a certain number of therapy appointments and things like that. And I can access that without it going back to the state bar that I accessed that therapy, right? It's supposed to help me before it's an emergency. I hope that kind of clarifies what we're talking about here. This is mental health care, not crisis care. So this is, and it would allow that mental health care professional to report if that physician or nurse or whoever is no longer competent to practice or poses a risk to themselves, their patients, or anyone else around them. So if that mental health care professional, just like in typical mental health care, feels that that physician, nurse, et cetera, poses a risk, they can still report that to whoever needs to be reported to. So I just want to read from Dr. Callens, who unfortunately was not able to stay to join us for this meeting. She is the chair of our Workforce Resilience Task Force at MAG. She said an ounce of prevention is worth a pound of cure. Unfortunately, I don't have her bubbly personality, but I will try to provide you with what she said. It is even more critical today for us to take care of physicians and healthcare workers, not just from an acute standpoint or a momentary crisis, but it is essential to move to a preventative standpoint where we encourage participation in wellness programs to identify and intervene in career-related stress and burnout that impacts healthcare workers and their families. I'll make a simple parallel. We encourage people to see a primary care provider for preventive care instead of relying on the emergency room for emergencies that would have presented otherwise. In this situation, we are trying to avoid loss of function or loss of life or somebody leaving the practice healthcare altogether. So we have physicians and nurses leaving healthcare at increased rates. There was a recent AMA survey that said that 1 in 5 physicians plan to retire in the next so many years, and that has increased significantly recently. And a lot of that is due to the increased burnout and administrative burden. I had a physician today that told me that only 40% of her time is spent on patient care. So they're experiencing the administrative burdens all the time that can kind of end up in this very stressful position. This will allow our healthcare heroes to be comfortable in utilizing wellness programs without fear that admission of needing help for burnout, stress, anxiety, career fatigue will jeopardize their employment or their license. And it will allow participation to remain confidential and licenses to be protected when there's a need for this kind of program. And she closes when saying, when a flower doesn't bloom, you fix the environment in which it grows, not the flower. Thank you for your consideration of this bill, and we really appreciate all of the work that you all do to help our healthcare workers. Happy to take additional questions about how this looks, but the program kind of has different stages in terms of what it offers and the different advantages that it has depending on kind of what type of program you're using, but it has, like visits to a therapist and things like that included.
Sure, go ahead. Representative Prince.
Thank you for that explanation. Now, is this program outside of the hospital?
Yes. Yes, it would be provided under the auspices of MAG. There's a program in Virginia does this through their medical association. It's called Safe Haven, and your hospital or your practice would be able to pay into it to allow you to utilize the services that it provides.
Sounds good.
Okay. Other questions from the committee? Okay. All right, Tim Kibler. Thank you, Bethany.
Thank you, Madam Chair. Thank you, Mr. Chairman, for bringing this forward. I am Tim Kibler with the Georgia Alliance of Community Hospitals. We're 92 Hospital Association of Georgia's not-for-profit hospitals. So some of these folks will be working in our facilities. We very much want to do the things that we can to encourage them to seek the care they need at the appropriate time. Very much support Dr. Newton's bill and would ask the committee to favorably approve it at the appropriate time. And I'm glad to take any questions if there are any, Madam Chair.
Are there any questions for Tim? Okay, so basically it's sort of a program. I sort of see it as a program where you can let off steam and complain about everything that's bothering you. If you're not sleeping, your schedule's bad, or it could be like we get toward the end of session. It'd probably be a good idea if the legislature would set up a program for legislators. We might go around smiling a lot more. But just like legislators are always, I remember we were debating something and the PBMPs, and it was, oh my gosh, somebody might get in there and use that against us. They would get into the PBMP, and if we were in there and had, taken something to help us sleep or something like that, and it was reported. Does anybody remember those discussions when we were here? And so when it means a safe haven, it's a place you can go. Professionals are always very worried, besides politicians, about their personal information coming out. And so this is a place, a safe haven where they could go. And like Ms. Shera said, it's a crisis level. To get help. Who's 25? Representative Hatchett.
Like at the appropriate time, make a motion.
This is the appropriate time.
I move that do pass on LC 339099S.
We got to do pass in a second. Is there further discussion? Okay, seeing none. Everyone in the favor of the passage of the substitute to House Bill 1533, LC 33909-9S, say aye. Anyone opposed? No. Okay, the ayes have it. Thank you
Thank you,
very
ma'am.
much to the committee.
Thank you, Madam Chair. And we will move on now. Thank you, committee, by the way, to House Bill 1403. We will, and with this, Representative Crowe join us and tell us and make sure if you can read your LC number you're working from.
Yes,
I
sir,
like
Mr.
the
Chairman.
one-page version.
Yeah, thank you. This is House Bill 1403 LC 338997. Everybody got it? We also have, I think there's a couple of people gonna testify, one or two when we get done. This is obviously an amendment. It's an amendment, it's a very specific amendment to the CON laws. And what it would allow for is the establishment of an acute care hospital in rural counties that would not be required to meet the CON requirements. It's a very specific bill. It is established in a rural county as defined in code section 3189.1. That would be counties with 50,000 population and less. Provide inpatient hospital services, participate in Medicaid and Medicare. In the way it's also written, it would require basically in this situation to have a current 3-year average patient margin. So what the current situation is we're trying to move a critical access hospital in Butch County, build a new facility in our community. It's been needed for many, many years, according to a lot of folks in our community. And what we're trying to do is do that without being held up, without having to wait for years. So it's been needed for a long time, and we're trying to get that done now without having any further delays. We do have some folks here that can speak more about that in a little bit, but there's been a lot of talk, a lot of conversations I've had with folks that thinks that it's attempting or can possibly hurt other existing rural hospitals. That is certainly not that's not the desire. It's not my desire. I don't think it's anybody's desire. We don't want to do away with any existing hospitals or cause them any undue harm. We're trying to establish new hospitals, more healthcare, especially in rural areas and specifically in our community in the Butts County area. So with that, I will take any questions the committee may have.
Chairman Nix.
Thank you, Mr. Chairman. You mentioned the fact that it calls for a 3-year patient average, but it's not there. Where are you going to get the 3-year patient average without an existing facility?
Yes, sir. That and that was in fact, just as recently as before the hearing started out in the hallway, some discussion on that. What we're looking to do in this specific instance is do a replacement hospital. So currently in Butts County, we have Sylvan Grove Hospital's critical access hospital, been there for many, many years. And what the folks do in the new hospital would be to replace that hospital. There's been talk with the hospital authority about buying that facility from them. So it would be a replacement hospital. It would be a newly established hospital, but replacing that one. So the license would essentially, as I understand it, be transferred to this new facility. So the way I read it and the way it's been explained to me, which again, there has been discussion with a differing opinion, but the way I read it, the way I understand it, this would only apply if you were moving or replacing an existing hospital with establishing a new hospital to replace an existing hospital.
Can I follow up?
Sure, certainly.
Was there a CON applied for this before you came here?
For this particular instance, no, sir, not in this, not for this hospital they're looking to do now. No, sir.
And if it's replacing the other hospital,
Mhm.
at what point would all of this transfer over? I mean, what's this going to do to the critical access status of the other hospitals in Butts, Monroe, and Jasper counties in this service delivery area in the interim here? Are they going to lose funding? What's that going to do?
No, sir. I don't see anything in this bill that would cause them to lose any funding or have any impact on them whatsoever. The critical access hospital in Butts County, which is Sylvan Grove Hospital, this would essentially be a replacement, a newer, bigger replacement for that existing hospital that's in Jackson now.
Chairman Corbett.
Thank you, Representative Crowe. Question on the rural hospital definition, 50,000 or less.
Mhm.
In that code section, does it have anything to do with it if a county has a military facility in that county? Would they not be required to, I mean, they could have over 50,000 if that's the case. Is that in that definition? Do you know?
This definition was taken from, I believe, the Georgia Heart requirements, eligibility requirements for the Georgia Heart Hospital Program. And that's where the 50,000 population was defined. So that language was just mirrored.
But
And I'm sorry, I
nothing
don't
about
have-
a military installation in the county. They waived the 50,000 requirement if that's the case.
is if that's in the Georgia Heart Program, then yes, sir. I don't have that in front of me.
Chairman Perkle.
Thank you, Mr. Chairman. I know you stated that it's not in your intention to impact other rural counties and rural hospitals.
Yes, sir.
So a concern that I have, and I have, much to the chagrin of some of my friends, I have not always supported all the CON changes.
Yes, sir.
My concern is that it would impact some other hospitals. I know it's not your intention, but we've got it's black ink on white paper. that were it to impact it. And I know there's other facilities around this. I mean, Cuthbert that closed, they would, you wouldn't have any trouble opening that hospital, I would think, because it is now no longer operating. In this particular instance, do you think it is possible that it could impact other rural hospitals?
No, sir, I do not. Not in this particular instance. And the way the bill, to my reading, is drafted, it would not. You would essentially have to be replacing an existing hospital that met this patient margin. So I don't know how anybody could come in and do that in some of these other rural counties. That's, like I said, that's not my intent. And I don't think that's I don't think that is the result of the bill, the way it's written.
Representative Crowe, but did you say you had some others that were going to speak on this?
I do.
That are here, that,
Yes.
are they going to be able to address what other hospitals are close by that there might or might not close by, whatever the closest hospitals they might can address
Yeah. In fact,
their reason for thinking it would or would not?
Yeah, and one is a former administrator of Sylvan Grove Hospital, our critical access hospital in Jackson, Mr. Ed Whitehouse. So he'll.
We've got a few more questions. Let me go on.
Right.
Representative Chairman Houston.
Well, is it not true? One reason you didn't want to go through CON, it would take you so many years to get through.
My understanding, yes, ma'am, is that is a long and arduous and possibly expensive process. This is something that's been talked about as a need in my community for 20 plus years.
Yeah.
And I think that any further delay, anything that we could do to lessen any further delay, I think would be beneficial to our residents in the community.
Could you tell me when this hospital was built?
Sylvan Grove?
Uh-huh.
I'm sorry, ma'am. It's 1960s, possibly 50s or
Okay.
60s. It's
So it's time to update.
it was way before I was born.
Okay, thank you.
Thank you. Chairman Knight.
Thank you. Representative Crowe, I'm familiar with it. I'm obviously neighbors with Jackson and Butch County, and used to represent that area. I am familiar with Sylvan Grove and will attest, as the chair lady just mentioned, as to age and I guess the need for a new or updated hospital. And I guess maybe a follow-up to Chairman Perkle's question about who it will affect or how much it would affect surrounding hospitals. I would tell you they're already servicing patients. So, I'm not sure why there's that great worry. I mean, unless you're about to double capacity or triple capacity. I mean, certainly with the growing population on the south side of Atlanta, as it continues to grow and grow, further south, population is increasing. That's a great question. I mean, why should we, have to get a certificate of need to build a new facility? Do you know if it's, how much bigger it is? I mean, is it significantly larger? Is it?
Yeah, and Mr. Whitehouse could probably speak to this better. I know the proposal would be, the new hospital would be 100 beds. Sylvan Grove is less than that. I'm not sure how many, exactly how many we have at Sylvan Grove now, but it would be larger.
And it's an acute care hospital, which is not necessarily a place where you've got surgery. My understanding of the definition, and I'll ask for clarification, but it's usually where somebody goes after a trauma, an accident, after a surgery to rehab, if I will. Is that, and I may be missing some of the definition of it, but I know that's.
You say you have your administrator here with you though, right?
Yes, sir. Yeah, and I would defer to him, but that's my understanding as well, but I certainly am not an expert in that area.
All right. Thank you.
Representative Bentley.
Sir, thank you, Mr. Chairman. Representative Crowe, my seatmate.
Yes, ma'am.
I just want to make sure I'm understanding. I've been listening carefully to all of my questions from my colleagues, but this is a new project that will go from a 60-bed facility to possibly a 100-bed facility?
It would go to 100 bed. Yes,
100 bed.
ma'am. And I believe that 60 beds may be.
Okay,
what the
so
hospital has.
with current CON laws,
Mhm.
that's why I'm trying to get a clear understanding. Under current CON laws, just to, if you wanted to just, if you just wanted to remodel the hospital and keep it at a 60-bed facility,
Mhm.
will you CON still be, CON will still have to be considered just to just to remodel the hospital and fix it up and make it, just keep it at a 60-bed hospital where you still have to, I'm just trying to figure out what is the real concern. Is it because it's going from a 60-bed facility to a 100-bed? Where does CON fall into this? You know, if it was a 60-bed, if it were remaining a 60-bed hospital, can you, you would need this law? Is it because we're going for a 100-bed facility that now we need this bill 1403?
My understanding is that because it would be a new facility, a replacement facility, that it would fall under the requirements of the certificate of need laws. As to why, I don't know. You need to ask some of our
Yeah.
hospital friends. That.
Even if it was staying at a 60-bed facility, still got to go through the.
Yes, ma'am. That's my understanding. But in this case, it's going to be moved to a different location in the county out closer to the interstate. And just to add to that, there's a $2 billion development being done in the same area, industrial and manufacturing development being done in that area too. That
Okay.
area is rapidly growing in population and businesses. And so this would put it closer to that area as well. So there's major growth happening on that end of the county, and this would shift it out that way. So,
Follow-up question, if I may.
yes, ma'am.
So in that area where this big development is taking place, is there another medical facility kind of close by, or?
There's not. There's there is a hospital in Griffin, Spalding Regional Hospital. Yeah, it's and Wellstar manages Sylvan Grove now and Spalding, and so it would be a little bit closer.
Mhm.
Then it'd be probably, I think it's 8 or 9 miles closer to Griffin, but it would be at the interstate where all of this development's going.
I understand. Thank you.
Yes, ma'am.
No more questions at this time. Who, I know you had some people who drove a long way to make our 3 p.m. meeting today. If they would like to speak, we'd certainly be glad to entertain that.
Okay. Yeah, and they're on the
Thank you.
list. I guess, Ed, did you want to go first?
Whatever you
Okay.
think. You have 2 individuals, is that right?
Yes, sir.
We may hold some of our meeting over to tomorrow when we already are scheduled again back in this room at 3 p.m. But do want to respect the effort to come up here and be with us today, and apologize that the work of legislating is not always as predictable as we'd like it to be, but neither is healthcare. So
Fortunately, he has some experience in that. So
sure.
Well, thank you, Mr. Chairman. My name is Bill Jones. I'm from Jackson, Georgia. And in fact, I used to do a little of this same work that y'all are doing today. So I have a little bit of an insight on what you're doing. I was here during the years of George Busby and Joe Frank Harris, as a matter of fact. So had a good tenure there and learned a lot. I said anybody that serves more than 6-8 years in this august body ought to have some type of higher education degree awarded to them, because they'll see about anything and everything come before them. By way of history of what we are doing there, what we attempting to do, I happened to be a teenager when we dedicated that hospital in Jackson, Georgia. It's one of those Hill-Burton hospitals that was authorized by the Congress back in probably the late 50s. And this unit will be 60 years old this June. I was there for the dedication service just as a teenager, and it was a big deal. You know, that very few people rural areas had hospitals then. And at the time and during the tenure of that unit, we have had a lot more services that were performed at the hospital than is the case today. It's pretty much just a rehab, 25 bed, not 60. 25 bed hospital today. And according to the, I believe it's the Department of Community Health, is that correct? According to their criteria for measuring the bed need in this particular area, it is now a 300 bed qualified unit under their rules. And of course, that takes in a number of counties that join right there at that, pretty close to this intersection. Ed Whitehouse, who used to be the administrator, will answer a lot of technical questions that you have that about the hospital. He was administrator there for a number of years. And this is 60 years later now. We'll celebrate the anniversary in June of this year. And we haven't been able to move any. And as you know, if you live out any distance from any hospital that has multiple services, it's usually a northbound trip up Interstate 75. I was on my way to Emory just the other day to get some work done, and I was in gridlock 40 miles out, you see, before we could even move. And it took me 2 hours just to nudge up to the farmers market out here. So it's we feel like it's time. Clint mentioned that there was probably the next to the largest development going on in the state of Georgia right now, next to the Rivian car manufacturing proposal that's being done on I-20 out on in Newton and Walton and Morgan counties out there. But next to this is actually going to, built out is going to triple the digest of the county that took it to the point from 1825 to now. In next 30 months, it'll triple the digest, to give you a sense for the impact of something like this. I don't know that we would entertain 300 beds, even though it qualifies it. You know, the question of whether or not you might provide for growth into that size and grow into it if it found the need was there. But most people are not going to invest in something that is on the cutting edge of what maybe the community health department says is what it would qualify as far as beds are concerned. The only thing I've been around these halls before, and you're always trying to find out what the opposition wants to talk about. And the opposition, from what I understand, wants to talk about the impact it will have on other hospitals in the state. This bill is specifically addressed to those hospitals, rural hospitals, that have already been identified by the Georgia Heart Program. And if y'all are familiar with that, you know how that works. It allows you to, on these rural hospitals, to designate or write a check actually to the hospital and take credit for it on your state income tax return. And I think the state has maybe a $50 million cap. We've done it for 3 years consecutively to hospitals in our area. And I know this year we had to pledge it early. Otherwise, the cap was going to be met. So it's a popular program, but it's designed to help those hospitals that are identified in the Georgia Heart Program. And they are specific. There's one in Jasper County. There's one in Morgan County. There's one down in Cochran, Georgia. There's one, there's 55 of them out of maybe 255 hospitals in the state. And what we are trying to avoid, and when we first started talking about this, to give you a sense for what is out there in the real world, we had a law firm from the state of North Carolina, over in Raleigh, North Carolina, wanted to come in and make an appointment, and they wanted to talk about representing us in getting a certificate of need addressed. Now, when in my conversation with them, they're pretty economical. They charge $600 an hour, and they projected that it wouldn't take more than 3 years to get it through, to get it going on and identifying what we know today is the need. But we have an apparatus seemingly that permits anybody from any area in the state to come in and complain. And then it gets to be a trial lawyer playpen, you see. We can drag it out and build the hours. And I can tell you from this standpoint, you couldn't afford the $250,000 to $300,000 worth of fees it would take to navigate the certificate of need question. They are moving it to a granting of a need, of the certificate of need. It doesn't replace, there's two things here. You got a certificate of need and you have a license. You still got to have the license. The Department of Community Health, if this exemption is permitted by this committee and by the legislature, as far as being able to just take this exemption and say, I'm going to pick up my license next step. It doesn't work that way. You got to still illustrate to the Department of Community Health your eligibility for that license. So it's not like you're going to turn loose all these scavengers out there and run in there and take the place of rural hospitals that currently exist. As Clint mentioned there, and as I have understood, that opposition says that's what you're going to do if you adopt this exemption. I think here about 4 years ago, maybe 5, we had a similar situation with the Cancer Treatment of America that wanted to locate in Newnan, Georgia. And there was an exemption made for them so that they didn't have to comply with all the minutia, rules and regs to get a certificate of need addressed. And they over there today operating. And I for the life of me, I don't know how they're hurting anybody by doing that. But that was an example of an exemption that was granted. And this list of hospitals this applies to is taken directly off of the list that the Georgia Heart Program has already identified that qualifies for the contributions of state income tax. And to say that you can this is an invitation for new startup units to come and just plop down, say, aren't you from Butler, Georgia? Okay, it's say, I don't think you have a hospital, so you wouldn't have a problem there. But say in Cochran, Georgia, just Jefferson County, okay, they couldn't just use this exemption and come in and just say, I'm going to apply and get a certificate of need and be competition for you. They don't fit it unless they're on their Georgia Heart Program list, and it's specific. And so, in the bill, as Representative Crowe said, one of the things you have to illustrate that you've been in business for 3 years, for you to qualify for the exemption, as stated and given 3-year history on your operations there. So, at any rate, I think that's a non-starter as far as grounds for being opposed to it. So I'll stop right there. I could talk all afternoons, but Mr. Chairman.
Thank you for that. Are there any questions for this speaker? All right, if not, Mr. Whitehouse, if you could come and join us. And
thank you very much. My name is Ed Whitehouse. As Mr. Crowe mentioned, I was the hospital administrator at Sylvan Grove Hospital for almost 12 years. And this is a project that I've been working on. I was actually recruited by the former owners of the hospital, Tenant Healthcare, back in, like I said, 12 years ago. And what we did then, we looked at, as Mr. Jones said, the actual bed need. And it really hasn't changed much. What we're talking about is a proposal that would help rural hospitals. And exactly what Mr. Jones said, the wording here, I know there's been some confusion. And there, one thing I looked at on line 11 of the proposed bill, it says an acute care hospital established on or after July 11th, 2022. That seems to be a sticking point for a lot of people. Maybe we should have said an acute care hospital that is currently established on or after July 1st, 2022, because that's the intent. We have, 55 rural hospitals that we mean that this bill should apply to. And that's it. It's nothing more complicated than that. We're not experts in writing statutes. We kind of did this in a hurry, and that was our intent. And I think, they're both correct that, if you get later into the bill, it talks about a statewide 3-year average. Obviously, you can't have a new hospital come in because they don't have the 3-year thing. So I understand the, some confusion that and inconsistency in that, but trust us, that's what we meant by this. If there's any confusion. My role in all this has really been on the technical side, how much it would cost to run the hospital, how much it would cost to staff it, how you would get bond financing for it. And I have to tell you, it's been going exceedingly well. I think other people have recognized that there's a need for this hospital, and we have investors that are interested in putting money into this hospital. One of the other things we talked about, not only the hospital bed need, there's a huge shortage of mental health services, not just in Butts County, Georgia, but all of Georgia. So again, we had an outside company that I actually used to work for. I contacted them. They manage psychiatric hospitals all over the country. They have over $2 billion in investment in hospitals and psychiatric hospitals. And they told us they were keenly interested in this project. They came down on their own dime and did their own feasibility study for the need for psychiatric services. And when I say psychiatric services, I mean adult inpatient hospitalization, child and adolescent hospitalization, and substance abuse, and geriatric hospitalization for psychiatric patients. And their need, they showed a need for over 250 beds for psychiatry. So they said, if you guys can get this new hospital built, we'd like to do something jointly with you. We could put, 20 or 40 psychiatric beds in there and manage it with you, co-manage it with you, or we could, build something on our own. So there's a keen interest in that. And I think, I was glad to see the legislature just passed a mental health parity bill. And this goes in hand with that. And I think again, the intent is rural hospitals. The question is, I'm familiar with all the hospitals I worked there. Monroe County Hospital has a 25-bed critical access hospital. They are struggling, as all the rural hospitals. Mr. Veazey's here today. We talked to him. He's one of the healthcare experts. We talk about this a lot. These hospitals need help. We don't need, people trying to put more expense on it. We should be trying to make it easy for people to expand. Where the money is going to come from, we're very confident we can raise the money. And, that's all we're asking for. We're not asking for something that's going to open up the floodgate for outside interests and people out of state to come in and do whatever they want.
Well, thank you. I know we had some kind of informational or hospital management questions from the committee, from members of the committee. I know you mentioned something about the bed size and the neighboring hospitals and distances from both the current facility and the proposed facility. Would it be fair to say one of your goals in this bill is to be able to begin? I assume it's a two-plus year building process to build a hospital. Yeah. And you mentioned the growth. I think Representative Crowe, you were trying to get ahead of the curve to where the capacity is there as the development goes forward.
Well, I think we've been behind the curve for several years. There's obviously been a need there, according to the numbers that we've seen in the study. But yes, it's about to, the growth is about to increase significantly in that area. And it's going to be there long before this hospital would be if they started building today. So, and that, because not only are we having the businesses in this large industrial development, you know, there are homes and neighborhoods that are coming with that to provide homes for workers. It's the population increase in that area is going to be dramatic over the next couple of years based on all this economic development going on.
If you could both hang around just a minute while we go over some questions. Chairman Nix, I believe.
Yes, thank you, Mr. Chairman. I'm a little bit confused. I believe you mentioned that Wellstar manages the current hospital. Is that correct?
They do.
And you're talking about investors in a new hospital. Who owns the current hospital?
The Butts County Hospital Authority.
Are they requesting this?
They are on board with this, to my understanding. They've had meetings. I've talked with several members of the hospital authority, and they are interested in it as well. Yes, sir. They would sell the current plan, and I don't want to speak out of turn as far as, you know, somebody else's money. But what I understand is there's been talk about a group of investors or this group buying the current building from the hospital authority and partnering with them on this new one.
And the hospital authority would still be involved, but are they here to say that they want this, I guess is the question I have.
The chairman was going to be here, but you know, we just got word of this committee yesterday, so he's a banker and has some meetings today. I can tell you the nature of our discussions with the hospital authority has been, number one, we presented this proposal to them, and their reaction was, well, that's good. We could use more healthcare. They're not experts in the field. You know, what would it mean? And we've kind of tried to work that through with them. We've talked to outside groups. You know, and when you talk about this much money, we really can't get into the specifics of, you know, even who we're talking to about that. But you know, in close quarters with them, we have revealed that. And they said, look, if you can make that happen, it's sorely needed. You know, who would be against that? You know, the hospital itself is a 25-bed critical access hospital. It's a separate licensure category from a general medical hospital. So, you know, our proposal would be to upgrade from critical access to general medical. The hospital, what it currently does now is mostly subacute medical care. As someone mentioned before, this would be people who went to another hospital, had orthopedic surgery, and then they would come to Sylvan Grove to do inpatient and outpatient rehab. It also has an emergency room that services that community, but it doesn't offer the full range of services that people who live there have to go 40 and 50 and more miles to get.
This is, oh, go ahead.
Would you anticipate staying with Wellstar as the manager, or would you would anticipate this being a whole new entity? I don't understand how you go from the hospital that's there to a new one, the hospital authority, and you're going to have investors. I don't understand the process of doing that and how this would be exclusive to this community.
You know, Wellstar has been an excellent steward of that hospital. And, you know, it would be a privilege for us to be partnered with them in any way they would be interested in doing. I can't speak for them, but, you know, they're a strong healthcare provider, you know, and that would be perfectly fine with us.
So this is not moving the certificate of need. This is an exemption from the certificate of need process.
It's an exemption from the certificate of need process. And we feel very confidently that, you know, the first hurdle in the certificate of need is there a bed need? And yes, overwhelmingly, there's a bed need.
And it's the 3-year delay that you're trying to avoid, and the
delay
$600 an hour for 3 years.
and the cost.
All right.
Thank you.
Chairman Parrish.
Excuse me, I've got a couple of questions. If you could help me understand, you touched on some of this. The current hospital, you said, is acute hospital, has 25 beds.
It's a critical access hospital, 25 beds.
Okay. And then what would the new hospital be?
The-
How many
the-
beds?
We anticipated no less than 100 beds, possibly more, but certainly build it so it would be expandable.
So it would change the mission of the hospital, so to speak.
It would change the license category from,
Right.
subacute, critical access to general medical.
Right. And would you explain again who owns the current hospital and who would own the new hospital?
The current hospital is owned by the Butts County Hospital Operating Authority. And the new owners is yet to be determined. We certainly would participate in that, but we would invite other interested parties who may want to partner with us.
One of the last question, Mr. Chairman, does the Butch County Hospital Authority have an interest in building a new hospital?
They don't particularly have the money or the resources to build it themselves. I can't speak for the hospital authority. I think they would, any hospital or county would be tickled pink to get a new hospital that they don't have to pay for. Right now, Butts County itself, the Butts County Commissioners pay 1 mil of real estate tax that's designated to support that 25-bed hospital. And then they pay some additional money to offset the cost of indigent care at that hospital. Our discussion with the hospital authority and the county was that would go away. So it would be about the 1 mil of real estate tax that would go away is in the $700,000 range savings to the county. And I think it's about $537,000 in subsidy for indigent care, which the county would no longer be responsible for.
Yeah. And I am curious of some of the questions. I know, again, familiar with it, but I guess I'm sort of confused. Obviously, Wellstar is I guess leased the current Sylvan Grove or is the hospital that runs the Sylvan Grove facility, correct?
Yes, they manage it.
So I guess from my perspective, having, Spalding County, and that's, we have Wellstar there. We're not 30, 40 miles away. We're probably 10, 15 miles away. So how does this affect? Because I think maybe to Chairman Parrish's question, mission and all that, because now all of a sudden you've got two hospitals that are 15
Competing.
miles away from each other.
It's about
And
20
I'm-
miles, as the crow flies.
But I am curious about that and from a perspective of, that close.
Yeah. And let me best speak to that as my experience I had with both of those hospitals when I worked for Tenant Healthcare, the owners before Wellstar. I was on the A team at Spalding Regional. I had some management responsibility for certain departments there that were commingled with Sylvan Grove. And our thought process and Tenant Healthcare's thought process at the time was that the competitive market is and the market itself is growing so much that there needs to be a new facility. The hospital in Spalding County is aged. It's like I said, it's about 12 miles from the interstate. It's not the garden spot of Middle Georgia where it's located. Tenant, at least then, I can't speak about Wellstar or anyone else. Tenant at the time didn't see the wisdom of investing and building a new hospital at the current location. What they recruited me for was to build a new hospital at the location, essentially we're talking about now at the interstate, with the hopes of making it more convenient and commercially viable and not abandon Spalding Hospital. But as the new hospital at the interstate would be built and grow up, Spalding Hospital would be retuned. So some of the services that currently at Spalding may go to the new hospital and like that, but you would always have the need for a hospital in Griffin. But at the time, Tenant's, explanation to me was, we got to do something. We either got to modernize, and if we're going to put money into a new hospital, let's put it where it has the most likelihood to succeed. And that was the location that we have now. The hospital in Spalding, again, I love both of these hospitals. I work for them. I'm proud of both of them. That hospital does about over 50,000 emergency room visits a year. Sylvan Grove does probably 15 or 16,000 emergency room visits. But, things have to be built up and keep up with the times. And, our thought is whoever's managing any of those hospitals, we'd love to talk to them about doing something jointly. And, those hospitals have always been co-managed. The senior management and the support services for Sylvan Grove are provided by Spalding Hospital and Wellstar. And it works. There's a beautiful symbiotic relationship between those hospitals. So, like I said, we'd be, very desirous of working something out in that regard.
Representative Bentley.
Yes, sir. Thank you, Mr. Chairman. So I'm just want to get a better understanding of certificate of need laws. Without this legislation, what would the current certificate of need law require you to do to implement this project?
It would be the normal process,
Which is?
we'd have to complete an application, which would first of all require us to hire experts. And we've already had an estimate on that. That's about $200,000 just for a CON application expert to fill the application out for us. And then that application gets submitted to the department, and we would go from there. And again, I think the 2 to 3 year timeframe for that is accurate. Once the application hits the department, then there's the reaction. The reaction is all the healthcare lobbyists, all the other parties, the hospital associations. If they felt that this was not in their interest, they would file against us, protesting, seeking that the certificate not be granted. And then it's a lawyer battle at that point.
A quick follow-up, if I may.
Sure.
I'm sure there's going to be some others come and share opposition to this legislation. And I hope someone will talk about what happened in Peach County some years back. The city of Fort Valley had a hospital, and this story sounds very, very similar to Peach County's hospital.
Yeah.
City of Fort Valley had a hospital, was in bad condition, needed to be remodeled, and they ended up moving to Byron, Georgia, and built a whole new facility and tore down the one in Fort Valley. So I'm just curious to know, did Fort Valley, Peach County have to go through all those steps to get that new hospital? That's really not a question for you, but I just want to put it out there because I'm hoping someone will touch on that when they come up to speak afterwards. Thank you. Thank you for that information.
Thank you.
One last question, if you don't mind. Thank you for working with this Majority Whip Hatchett.
Thank you, Mr. Chairman. Mr. Wiles, would it be fair to say that were the CON process not in place, that the hospital authority could possibly have already started construction and even built a new hospital and serving the citizens of that area, have given them a lot better healthcare access?
Yes, I mean, Georgia's, I think there's about 30 or 35 states that even still have certificate of need laws in place. So obviously, if there was no certificate of need law, we wouldn't have to go through that process. We would still do our due diligence. We would do a financial pro forma. We would seek funding. We would seek partnerships. We would do, what you would expect on a new venture like this. And we would seek to have it licensed.
And the pre-enterprise system would do what it does.
The licensing process is not easy, as you can imagine, and for good reason.
Well, thank you for being here with us today. It is just about 5:30. I appreciate everyone's patience. We do already have a scheduled meeting for tomorrow from 3 to 5. It may not take that long, but I think at this point, we'll hold this bill for now. And we do have several that do want to speak regarding the bill. I appreciate it if you can be available by Zoom, that is an option. And in case there's a factual question or a correction or additional information that's needed, I appreciate you being here with us. And with that, unless the committee has another objection, we will adjourn until tomorrow at 3:00, where we have our next scheduled meeting in the same room. Thank you. Thank you all for being here.
Bill? I know the intent of the bill. Well, it's.
Yes.